On Facebook, there you go.
Okay. I don't see it yet, but. Are we on?
On my end, it looks like it says live on Facebook.
Okay. Okay. So here we are. We did it. I think we did it. Hi, everybody. This is Judy. And Judy, you want to introduce yourself?
Yeah, my name is Judy from Southern Minnesota and my colleague Aimee. And we are both TIPA Snow certified in positive approach to care with people living with dementia.
Yep.
And we're going to try to just kind of introduce you to what we've been learning.
Yeah. We were supposed to, we have a partnership with 125 Live, which is a senior, well, it's, how do you describe what 125 Live is? It is
it's a senior citizen center for promoting health.
Yeah, and we've been doing these live like not Facebook Live, but really live, like we're there and we have people come and we do these presentations. And Judy and I were kind of excited because this was going to be our first public group presentation of what we learned when we took this course, TIPA Snow's course on the positive approach to care. And we got certified and it was quite a process. We've done a couple of group trainings for our employees and our staff tolerated us as well. But this was going to be our first public and it was a little disappointing. So when we talked about doing it live and yeah, we just fumbled through that this morning and we're excited. We're not going to take up 2.5 hours, which the actual class is 2.5 hours. We're going to take it in little bits. So Judy's going to start us out talking a little bit about the brain, right, Judy?
Yeah. You know, when you look at dementia or you hear the word dementia, it's like an umbrella term for many different kinds of dementia, like Alzheimer's, Lewy bodies, frontal lobe, and probably 500 different kinds of problems you have with the brain.
There's like 100 different types of dementia, isn't that correct?
I think so. And okay. Even then, you need a medical diagnosis because just because you don't remember well doesn't mean that you have dementia.
Right.
So you actually do need a medical diagnosis. But once you get that, it's an umbrella term and it can kind of send you into a tizzy. And it is big. So we'd like to kind of introduce you to what TIPA Snow has to say about
the aging brain.
Well, dementia, but and what I would call stages, she uses much different, gentler terminology, and she chose GEMS. So
we're going to talk about the brain too, right? Sorry.
Oh, that's right. Yeah. And then we're going to talk a little bit about the brain, what it does, and then how you can identify the changes that are happening. So we start with the normal brain. And in the brain, you have, it's complicated at best, and they're still learning a lot about it, but they do know this, that it's the hippocampus part of the brain, which is where you do your learning and time awareness and familiar things. Memory, learning, just, it's the big part of your brain.
That's where the biggest change happens with dementia is that hippocampus. Right. So those 3 points were wayfinding, learning and memory, and time awareness. Go ahead, Judy. Sorry.
And then you get the amygdala, which is a little further toward the center of the brain. And that's where you have most of your primal or survival kind of instincts, where you fight, flight, hide and seek, pleasure seeking, your temperature, your blood pressure, your pulse, your swallow, your chew, your breathing, your infection control, just everything that your body needs to protect itself is there in the amygdala and survive.
I think it's interesting that it affects that area the very last. And I think the biggest takeaway I had with that is that when that develops first, you're born with that as an infant, and so you're born with it at birth, and it's the last thing to go for people that are living with dementia. So that's where you see some of those childlike behaviors.
That's right.
That's why you see some of that, because that primal instincts are still intact, but you're losing some of the other. And then I think we have the frontal lobe is next, right?
Yeah, and what I find interesting about the amygdala is it's your infection control. So when your body is infected with a bacteria or virus or a germ of some kind, your body will then get hot to cook the infection. Well, as you age, you don't always respond with a fever, but the body knows it's not feeling very well. So you'll behave differently. They'll test your urine or do blood tests and find you have an infection. They start you on antibiotics and hey, you feel better. So as your body changes, your body just can't fight like it used to. Everything's pooping out. And then you have your frontal lobe, which is the logical part of you, the visual part of you. You make choices, you can make sequence, it's impulse control, self-awareness, seeing other points of view.
And if any of you have teenagers, you know that this is one of the last things that develop, and then with your dementia clients, it's one of the first things to go. So you're back to that, the self-awareness and seeing other people's points of view, and then that impulse control, right?
Yep. Yep. So you know where it comes from, people.
Yep. So you know where some of that behavior is coming from.
So that is like the briefest of introductions to the brain.
Yep.
And people specialize in it for a reason. But what Teepa Snow has done is taken from you now have your diagnosis of dementia. All right, now what? So she has actually put it then into what we call gems, a very beautiful, gentle way of seeing where the brain is at. So she starts with your sapphire, which is a blue, beautiful gem. And that's your true blue, healthy brain. Now, your healthy brain means that you might forget, but we call it the doorway effect. Walk through the door, you forget what you were doing, but you go back into the room. Okay, now you remember. That is normal.
We're all sapphires, by the way. Everybody watching, all of us, we're a sapphire. And one thing about introducing you to these gems and understanding them, you could be, because sometimes, and Judy's going to talk about diamond next, but I can be a sapphire in the morning and I can kind of turn diamondish by the afternoon or the evening. So that's important to know too. So even with your dementia clients or family member, there may be 3 or 4 gems that they phase in and out of, and as time goes on, they might move into that certain gem more, but you might just see a little bit of the diamond, and then eventually you might lose more of that sapphire and stay in diamond and start collecting some of the others. But the sapphire was
and you're still able to learn. So for those of you who are learning Zoom or learning Facebook or learning how to type, you're still good. You're a sapphire, true and true.
Okay.
And then it moves then to a diamond, which is you're clear and sharp. You like the familiar. You might resist change a bit. And I know that that's kind of a broad thing, but this is where people really like the sense of a routine and they know what to expect.
Dislikes change. all of
Yeah.
us can, I bet, can be diamonds at sometimes, you know,
Yep.
that we
Yep.
like our routine
Yep.
and we don't like that disruption. I think that next one, blames or dismisses errors. Again, I can be diamondy at some at times.
Mhm. Become territorial, you know, like this is mine, or this is what I always do. I always sit in this pew every Sunday at church. It's, you know, that's becoming territorial.
Mhm.
You make mistakes during social interactions.
Great.
Sometimes it's a word finding problem, but yeah. And those symptoms may or may not be dementia related. That can
Right.
also be part of normal aging. But once that this is where you're going to start seeing changes. Things are going to happen. And then people move into the gem of emerald. This was the dementia is advancing. Then you get into this emerald, which is it's a beautiful green. You desire independence. Oh, I can talk. I don't have dementia, really. Um, uh, you're noticeably changing. Vocabulary is diminishing. Your comprehension is diminishing. Your communication has become very vague. You can't finish your sentences. Neglect your personal care routine. Now you were in a routine and it was very secure for you. Now that's changing. This is where you're going to need ongoing guidance and structure. Difficult finding a way from place to place, so don't drive.
I think the really key one here, again, when you look at some of these factors that label as an emerald, on the go with purpose. So that's the person that cannot sit still and they have to be going because they're not comfortable having that purpose, you know. So folding the towels, reorganizing the spice cabinets, and then move on. And
yeah,
but
the
also
little old lady who likes to putz.
Yep.
The old man who likes to be in the tool shed.
Travels in time and place. That one where they might get a little confused about some of the past might be leaking into their present. So, you know, just slightly.
Yep.
Great.
Yep. And then slowly you move into amber, where you're focused on the sensation, like the touch or the smell, the taste, the feel of a cup or something. But you're also losing your sense of safety awareness. So you're responding with impulse like a kid would. Like you just know that you want to get from the chair to the kitchen. You're not aware that you have to go through the table to get there. So you might stumble.
Or you might see candy in someone else's purse at coffee time. And without even thinking twice about it, that person might just go start rummaging through that someone else's purse.
Yeah.
Because
yeah. So those are the things.
I was going to say copies actions, not tasks. You're talking about.
So like if you're doing jumping jacks, or they're going to mimic or ape.
Versus saying, let's do jumping jacks. They're going to watch you, you know. So like,
but this is
I was going to say, like, are you enjoying your coffee? And then holding up the coffee, you know, is it good? That type of thing gives them more cues than the verbal words would at this
time. You like when you feed an infant, you open your mouth to open their mouth.
Yeah.
They open their mouth.
Yep.
I mean, they're aping, they're mimicking.
Yep.
They have difficulty understanding and expressing their needs. So this is where they're going to get frustrated or really angry because they're not able to get across what they want you to understand. So then it becomes kind of a trial and error. Well, do you need to go to the bathroom? Are you hungry? Are you thirsty? Are you tired? You know, this is the normal day where you go for a drive with your husband or your spouse or your family. Well, you know, do you need to go for a wheelchair ride? It's kind of exploring just some of that. It's a lot of trial and error.
Yep. Rubies. There's two more, by the way. So we started with sapphire. We went to diamond, emerald. We were just talking about ambers. And now we're going to talk a little bit about ruby.
Ruby. And ruby, this is where rhythm
Strong
is
red. Red.
Yep. Red. This is where rhythm in the red. This is where you can sing and hum and dance and sway, and they understand expressions and tones of voice. They're losing their ability to understand language. They don't necessarily see your mouth or eyes or fingers or feet, or they're losing their ability to use that, like the fine muscle dexterity for eating or combing their hair or tying a shoe.
But they retain strength, which I think is really interesting. So this, in this color, in this jewel, ruby, this is where you see a lot of hitting, pushing, grabbing on. We were talking about this earlier. This is the male client maybe that is very strong, and you're going to take something off of their face, or maybe push their hair back, and they don't know how to respond to that. They don't have the fine dexterity to pull their own hair back out of their face, but you're coming at them and they might grab you or push you. Same strength, just not the same skill set anymore. And then I thought that notices the tone of voice. You still can, Judy, it is time to eat, versus Judy, are you hungry?
Yep.
Should we go? Are you hungry?
Yeah.
Versus,
Yeah, verbal commands don't work here. So if you want them to move to one place or another, then it's like, okay, then you just start dancing or swaying or singing.
Mm-hmm. And that, I think that vocabulary really, it's hard for the ruby to find words, and their vocabulary is diminishing. But it's amazing how the rhythm of a song, and they can remember every word of a church hymnal.
Yep.
So that's why because it's rhythm on the right, Judy, and rhythm language on the left. And so the other way, but you lose language before rhythm. So that part of your brain, the language part, deteriorates before rhythm, which is why the music and the rhythm is really good for these stages. And even singing what you're doing, right, Judy?
Yep. And the singing, they might lose the words, but they know the tone and the rhythm.
And it's comforting.
Yep.
And then I think the last stage is,
which is pearl.
Okay.
So we've gone through the sapphire, which is true blue, diamond, which is kind of sharp and routine. Emeralds, you like to be on the go, there's purpose. Amber, you're kind of caught in the moment. Rubies, deep and strong, and people are losing their ability to talk or communicate. Now they're pearl, and you're hidden in the shell. So you're caught in moments of time.
Sorry about that.
Here, if for some reason they know your name, they haven't known your name, Judy, for maybe a few months, and you hear the name, oh, Judy, is that you? It is a golden moment, and you hold on to it. That is a profound gift that person has just given you. So familiar isn't familiar anymore. They might say Judy, but she might remember me as a young girl and not necessarily an adult woman.
Or just flashes of reality come in. And I think some people get discouraged with this stage because there's this thought that I can bring my loved one back, because they were just here. That was my mom, and she remembered me. And what were we doing at that time? We were doing this. So if I just continue to do this, I'll get that another moment. And that's not necessarily true. So I think the really important thing here is to enjoy that moment for as long as it lasts. But yeah. What else here? Reacts to touch.
Yep, they still feel. They might have primitive reflexes, like they may not be able to eat as well or chew, but they can probably still swallow a little bit. Not always, but a little bit. And the brain at this point is fading away, and the body shutting down. And here's where it's really tough for the family, for the caregivers, because they've seen this deterioration, and you need to give them permission to say it's okay to go.
Yep. Well, I think we've been on about 19 minutes, but I think we wanted to talk just really quick to give you a quick tip. So then if you join us next week, we'll go a little bit deeper in how to interact with all these different, some good techniques to interacting with these different gems. But I think we wanted to leave you with two things. Think about those gems a little bit, and the people that you're caring for, which gem might they fall into? And how many have you seen from your loved one or the person you're caring for? And if you would like, we can send you a photo that kind of just describes that a little bit more.
Yep.
And if you would like that, you can just comment in the comment section, and we'll send you that if you want to look at that a little bit deeper. But we wanted to leave you with an important part, which is the visual, right, Judy? So one thing that we learned, and we'll go over this in the meetings to come, but visual is always first.
Yes.
So our tendency is to either touch or yell first, but we learned that we do visual first, auditory second, and touch is the very last. So you want to get into your client's vision spot,
which is in front of them.
Right.
They're losing the periphery.
Yeah.
It's in front of them.
And in the end, they're kind of have this binocular view, which is even. And I thought with Zoom, it's kind of fun because you can see if I walk up to somebody living with dementia and they're in a wheelchair, and they have that binocular view. This is what it looks like. So how fun is that to hear my voice, but only see this? And that's not real cool. And then we talked about that impulse control. That's not good to be being in this range of sight either. So they just talk about making sure you get the visual first. Hi, Judy. So got Judy's visual. Hi.
Yep.
Good. And then before you touch, you stay in their eye, and so they can see your hand coming. And then if you're going to touch their knee or their hand.
That's right.
So remember,
this is extending an invitation into your personal space.
Right.
So if they do not accept that invitation, you are not invited in. So you got to see it.
Some of you. Yep. So I don't know who else watching. This is a time where we're not touching. We're 6 feet apart, but we do still have caregivers out there caring for our clients in their homes. So this is a great practice. And if you are watching and you're completely not around people, this is something that you can just practice yourself, or with your kids or with your family members, and just make sure you're, practicing that whole they don't have to be living with dementia. Just start practicing it with people you talk to. Can you see me first before I start talking, or reach my hand out, come up behind you and
yeah, it's scary.
Right?
Like if you touch them on a shoulder or you push them in a wheelchair, it startles.
Mm-hmm. So we're going to do this every week. We're going to, and Judy, just before we got on, talked about maybe some more ideas. So maybe you'll see us even more than just Tuesdays at 1, but we're for sure doing every Tuesday at 1. And we're going to be talking about the positive approach to care with people living with dementia. And if you have any questions, you can type them in there, or give us a call at the office. We're still here. We'd love to talk to you, talk you through any challenges you might be having. So we're super glad you came on with us today, right, Judy?
It was good. It was good to do this. Thank you.
Yeah. Thank you. Bye, guys. Thanks.
Bye-bye.